Good afternoon, everybody. So allow me a few minutes to please introduce the beginnings and also the process of collection of the newborn screening program and the treatment of patients in the newborn screening program. Okay. So, okay. We'll just let the slides move. Okay, so there you go. So we know that newborn screening is a public health program that aims to detect, okay, newborns who are affected by certain genetic, metabolic, endocrine, and blood conditions. So it actually was started by the group of Dr. Carmencita Padilla, a geneticist, who is now the chancellor of the UPPGH, but was then the director of the Institute of Human Genetics of the National Institute of Health at the same institution, and they started this in 1996. Okay, so what did they do? There were actually, let me put it up. Okay, there were actually 24 facilities that initiated this project. They were all located in the NCR. And when they saw that it was successful, they wanted to expand it into a national program. And it actually took them a while before they were able to do so. This was the first poster of the program. And you can see here, it depicts two children. The girl in orange shirt is actually was then a 7-year-old female who had congenital hypothyroidism, but if you can see, she's a normal-looking girl. This was taken because when she was actually properly treated, while the child, the adolescent to her left, is actually then a 14-year-old boy who was also diagnosed with congenital hypothyroidism, but was not properly treated. This poster was actually used by the different countries, and if you can see there, the flag of the Philippines was seen whenever this was used by other countries. Okay, so as we said a while ago, it took them a long time for the enactment of the Republic Act 92888, which is the Republic Act of the Newborn Screening Program of 2004. So it was enacted on April 2004, and it was signed into the implementing rules and regulations was signed on October 2004. And it was this time that it was included in the PhilHealth package. And these were the highlights of the Republic Act 9288. It included the creation of the Newborn Screening Reference Center, which will help the DOH in the implementation of the program, and the inclusion of the newborn screening in the benefits package of the PHIC. At this time, the price was still 550 pesos. It only included 6 disorders, which are congenital hypothyroidism, CAH, PKU, G6PD deficiency, galactosemia, and your MSUD. Okay. However, from 2005 to 2011, there was this study in the US, particularly in the area of California, among more than 100,000 Filipino-borns to newborns born to either Filipino parents or to interracial marriages. And they have found out here that there were almost 200 confirmed newborns with different disorders, namely your endocrine disorders, your inborn error of metabolisms, and even your hemoglobinopathies. And if you can see here, they even cystic fibrosis. Usually this is only found in Caucasians, but in this study that they did in the US among Filipino newborns, they noted cystic fibrosis in 5 from 100,000 population. So while they were lobbying with the DOH and the lawmakers to make it a national program, the Republic Act 9709, which is the Newborn Hearing Screening and Intervention Act of 2009, was also signed, okay, and approved. And the package was then also included in the PHIC. So after almost 10 years, actually 8 years of lobbying, the expanded newborn screening program was then included, okay, by the DOH in the guidelines on the implementation of the expanded newborn screening program. The goal here is to detect at least 28 disorders for Filipino newborns. And if you can see here, it even took another 5 years for it to be included in the PhilHealth package. Before, from 2014 to 2019, what they did was, if the parents decide to make use of the expanded newborn screening program, they had to shoulder an additional 950 pesos on top of the 550 pesos from the PHIC, because the expanded newborn screening program costs 1,500. But since January 2019, the 1,500 is being solely paid for by the PHIC already. Okay, so this is the newborn screening coverage as of 2019. The target of the program is that all Filipino newborns should be screened by 2030. But if you can see here, the highest screen actually is last 2015 with 77%, and the national coverage as of 2019 is only 75%. So we still have a long way to go, and that's why we are doing this, for us to be able to increase the awareness for the newborn screening. So this is the coverage by region. CAR has been consistently on top. And last 2019, we were only second to NCR. And our coverage is actually 88%. The blue bars are the old screens of 6 tests, while the orange bars are the expanded newborn screening already, screening tests already. Okay, so these are the ones included in your expanded newborn screening. There are 2 endocrine disorders, your congenital hypothyroidism and congenital adrenal hyperplasia. There are almost 20 inborn errors of metabolism, consisting of your amino acid disorders, your organic acidemias, your fatty acid disorders, and you also have your carbohydrate metabolism disorder, or your galactosemia, biotinidase, cystic fibrosis, and hemoglobinopathies, particularly your sickle cell disorder and thalassemias. And we also have the most common, which is your G6PD deficiency. Okay, so let me just explain the flow of collection to treatment in the newborn screening program. The newborn screening facility are those licensed to collect the blood from newborns and put it into the filter papers. So these are either institutions, lying in clinics, or your health centers who collect your samples. Once the filter papers have dried up, they are now sent to your newborn screening centers. There are 7 newborn screening centers in the Philippines, and for the Cordillera Administrative Region and the Region 3, we send our samples to the newborn screening center, Central Luzon, which is located in Angeles University in Pampanga. Okay, so while the Region 1 and Region 2 will send their samples to Northern Luzon Newborn Screening Center, which is found in Mariano Marcos Memorial Hospital. So what happens here is, we know that if the result is normal or non-urgent, such as if it's only G6PD or thalassemia, then we wait for the result to be sent back to the newborn screening facility, and parents will get the result after 2 to 3 weeks. If the result is positive or the screen is urgent, then the result is immediately sent to the newborn screening short-term follow-up clinic, which is also found in your newborn screening center. And the center at the follow-up clinic will then immediately call up within 24 hours your newborn screening facility, who will then contact your patient. There are even cases when the short-term follow-up clinic will immediately refer the patient to your genetics team or to your endocrine team prior to contacting the patient, or they can immediately contact the patient themselves. Okay, so once the patient is contacted, they are now asked to go to the newborn screening facility again for extraction. If they are not able to contact this patient, for example, change in address or change in contact number, then they now have to call on the Department of Health newborn screening coordinators to help them locate these patients. Okay. Previously, this is the end of the program. They locate the patient, tell the patient to go for confirmatory tests, either in the newborn screening facility, or they will be the ones to go to Manila for extraction and consultation. And they have found out that there were lots of patients who were lost to follow up with this program. So what they did now was to create a long-term follow-up clinic to follow up these patients. So what happens now is that these patients, once they are contacted, are asked to go to the newborn screening facility near them, and it is where they are extracted for the confirmatory test. Okay, so there are medtechs already trained by the DOH here in BGH for them to be able to know which taps to make use, whether green taps for inborn errors of metabolism or purple taps for your G6PD deficiency. And then the sample that's collected is now packed to confirmatory centers. If it's just your TSH and your T3 and T4, then to the local laboratory. But if it's for inborn errors of metabolism or genetic screening, they are sent to PGH, particularly to your Manila Endocrine Laboratory. So once they are confirmed to be positive, the names are then submitted to the Newborn Screening Continuity Clinic, and the patients are then asked to go to the Newborn Screening Continuity Clinic. And this clinic is responsible for counseling, treatment, monitoring, and follow-up of confirmed patients. So almost all regions have continuity clinics, and for the Cordillera Administrative Region, it's found here in Baguio General Hospital. And actually, we were one of the pilots here in Baguio General Hospital for the Newborn Screening Continuity Clinic. Our head is Dr. Sharon Gawigawen, and our nurse is Renz, okay, Florence Nestor. So our Newborn Screening Continuity Clinic has contacts with the genetics team in Manila. So we do telemedicines, we do conferences and consultations with them regarding our patients. And we also have contacts with our subspecialty team. So anytime this subspecialty team can be asked to look at the patients at the continuity clinic. And of course, we have our nutrition team. Our nutritionist, Ma'am Doms, has actually been trained in Manila to handle all these patients. Okay. Okay, so this is the census of the Cordillera Administrative Region since 2014, but the confirmed cases given to us was since 2010. So we had to recall all the patients prior to 2014. And we have actually noted some of them already to be with short stature. Others have really ambiguous genitalia who we had to refer to PGH for surgical correction. So we have a total of, excluding our G6PD, we have a total of 155 endorsed patients from your NSC and from the National Institutes of Health. And we have 7 deaths, 4 CAH and 3 inborn errors of metabolism with 112 active cases. These are patients either going to your private doctors, private endocrinologists, private geneticists in Manila, and those coming to our newborn screening continuity clinic. And we have more than 1,500 cases of G6PD deficiency. This number is actually lesser than the actual because we're still waiting for other names from the newborn screening center. Okay, so lastly, newborn screening program has come a long way. From 24 pilot hospitals, we now have more than 7,000 facilities with 7 newborn screening centers, 14 continuity clinics, and 29 G6PD deficiency confirmatory centers. And Baguio General Hospital is one of them. Okay, so our running time at the hospital, at the laboratories, every Tuesday. So please submit your samples before 10 a.m. of Tuesday, or let your patients come before 10 a.m. for collection. The result will come out on the same day, late afternoon, or the next day. And it's only worth 400 pesos. It's even cheaper than the ones that we were sending outside before because that was 600. But here at Baguio General Hospital, it's only 400 pesos. Okay, and so that is it for the introduction to the newborn screening program. So thank you, everybody.